the creation of this commissioner who will have the power to implement much of what is in here. You start then reading it and you really can't understand it because it's not written in plain English, although in the bill there's a requirement that stuff be written in plain English. And then you start getting into the penalties and the fines and the payments for people who don't meet certain regulations or certain requirements. I haven't gotten to the tax part yet, but as I've been briefed on this program throughout the day, I think we all recognize that this massive new free health care from the government is not going to be free. It's going to cost us a lot of money. There's a lot of stuff in here about the authorities of the IRS and what the IRS can do. And then you start getting in here and, you start reading what services are included, which ones are excluded, and those types of things. And what you recognize is we're going to see the same thing on on this bill that we saw on cap and trade. Remember what happened on cap and trade? There was a 900-page bill that passed out of your committee, and it, on late Thursday night, early Friday morning, when they didn't have the votes.
3:09 in the morning.
At 3:09 in the morning, they added about this many more pages to the bill.
316 pages.
316 pages to get to 219 votes, and nobody knew what was in it. And you're going to see the same thing here. This bill cannot get 218 votes because this bill will be out there for the American people to read for the next couple of weeks. But don't worry, the night before it will be changed, and there will be 400 new pages at least buying off members' votes to get something into this bill to get to 219, and that's how we're going to construct health care reform in America. Waiting lists are what I hear about all the time when I'm talking to our friends across the border, but what I hear from the medical professionals and the hospitals in Michigan is we treat the well-to-do Canadians who will come across the border and access our health care because they're unwilling to be on a waiting list. And they recognize that being on a waiting list isn't having your problem taken care of. If you've got to wait for, what'd you say, 117 days or 171 days? 117 days for a bypass. Excuse me, I think that's about 12 or 113 days. Too long?
116 for me.
106, yeah. If it were me, I'd say it's about 116 days too long. The same thing for a hip replacement and all of that. The American health care will fundamentally change if this goes into effect.
Reclaiming my